Good morning, everybody. Quiet day in the press conference today. I am Rachel Stephen-Smith. I'm the ACT Minister for Health, and I'm here to provide the COVID update for the ACT with our Chief Health Officer, Dr. Karen Coleman. I'll start by advising that we have 25 new cases today. 18 are linked to current exposure sites or are identified close contacts. 7 are under early investigation. Unfortunately, only 3 were in quarantine during their entire infectious period. At least 16 spent part of their infectious period in the community. So that is unfortunate, but we've talked before about the many reasons why people may be infectious in the community for a period of time. 10 people are currently hospitalised, 4 remain in intensive care, with 3 requiring ventilation. Dave Peffer talked yesterday about the exposure at the Canberra hospital, and I can advise that Canberra Health Services is continuing to respond to this evolving situation after 2 patients in the same room on a general ward at Canberra Hospital tested positive on Friday night. In promising news, there have been no further positive cases identified. More than 200 negative tests have so far been returned from both staff and patients, and I was advised this morning that all staff tests have now been returned and have come back negative. There will be more testing today, and the situation is being closely monitored. I'd like to take this opportunity to thank the outstanding infection prevention and control and infectious diseases teams who responded so swiftly to the situation. The positive patients are being cared for in the COVID ward, and the room they were in has undergone a deep clean. The ward has been declared a red zone and remains in lockdown. We continue to assess the risk to staff and patients have been advised to continue to wear masks and undertake frequent hand washing and hand hygiene, and to remain in their allocated ward. Patients who have already been discharged have been contacted and asked to get tested as soon as possible and to remain in quarantine until they receive a negative test result. Canberrans can be assured that this situation is being expertly handled, and they should feel safe to visit the hospital should they need to do so. As Mr. Peffer said yesterday, this is a circumstance in terms of having positive cases at the hospital that has now occurred on a number of occasions, and our team have expertly managed it. I think this was also the fact that all of the staff's tests have come back negative so far is a very strong indication of the infection prevention and control measures that are in place and the good use of personal protective equipment by Canberra Hospital staff. And so I really want to thank all of the staff for their commitment to keeping themselves, one another and patients safe at Canberra Hospital. In regard to testing, there were 4,339 tests yesterday, and this is a really good level of surveillance across the territory, and I'd really like to thank Canberrans for coming forward. We often see testing dropping off on the weekend, so to have that level of testing on a Saturday was outstanding. There were more than 440 tests at the Watson pop-up site, which is a really good result for this targeted testing effort. The clinic remains open today, so if you're in the Watson area and you have even the mildest of symptoms, please head to the testing site at the neighbourhood oval next to the Majura Primary School and across the road from the shops across Knox Street. Compliance efforts, of course, also continue across the ACT, and yesterday there were 1,277 traffic stops, 38 quarantine and business checks, 2 cautions were issued and 1 infringement for non-essential activity. In really good news, our vaccination rollout continues at a solid pace, and the ACT has now passed the 85% first doses mark for people aged 12 and over. I'm really pleased to see that GPs and pharmacies are continuing their strong vaccination rollout alongside the ACT government program, and we've particularly seen a strong uptake of the Moderna vaccine for 12 to 15-year-olds. And over the last few days, 12 to 15-year-olds have accounted for about 45% of Moderna vaccinations in pharmacies. There are more than 6,600 12 to 15-year-old Canberrans who have now had one vaccination dose, so that's around 1/3 of this age group, which is outstanding. And more than 12,500 young people aged 16 to 19 have also had one dose, which is almost 2/3 of that age group. So in summary, for those who might have joined late, we have 25 new cases, 18 are linked to current exposure sites or identified close contacts, 7 are under early investigation, 3 were in quarantine for their entire infectious period. At least 16 spent part of their infectious period in the community. 10 people are hospitalised, 4 remain in intensive care, with 3 requiring ventilation. So with that, I'll hand over to Dr. Coleman.
Thank you very much, Minister Stephen Smith, and good morning, everyone. So the total cases for this outbreak is now 750, with 25 new COVID-19 cases notified since our last update. Our total number of recovered cases is now 510. That's 18 more since yesterday. And our team continues to manage 240 active cases. So just to confirm some of the details you've already heard, of the 25, 18 can be linked to known cases or ongoing clusters, with the remaining 7 still to be investigated. Of the 18, 10 are household contacts. 3 of the 25 were in quarantine during their whole infectious period, and of the remaining 22, 16 spent time in the community for at least part of their infectious period, and 6 remain under investigation. 10 people are in our hospitals, with 4 of these in ICU and 3 requiring ventilation. Of these 10 in hospital, our youngest person is in their 30s and the oldest in their 90s. Of the total 10, 8 are unvaccinated, 2 fully vaccinated, and these are not in ICU. We now have over 950 self-identified close contacts, an increasing number of active exposure locations at 470. The good news is that there are no additional cases in today's numbers linked to the Calvary Hayden Aged Care Facility, so our numbers remain at 12 cases. That is 3 staff members and 9 residents. As our investigations continue, today we will be listing the Mary Potter and St Teresa households as exposure sites, to ensure that we capture anyone who may have visited a loved one at the facility. So please, if you have visited the facility during the last week or 2, please check on the website and make sure that you were not there. If so, please fill in the form and do what the website asks you to do. I'd also just like to take the opportunity to clarify that these cases are at the Calvary Hayden Aged Care Facility, which is actually separate to the retirement village of independent living units. There are no cases linked to the retirement village. Furthermore, we will be listing a new exposure site today, the Level 5 construction zone in Building 5 at 7 London Circuit in the city. We have several cases linked to this site in today's numbers, so please, if you have visited this construction site at 7 London Circuit, please check the dates and times on the website and follow the health advice. We are working very closely with site management to identify any further potential exposures and limit transmission as much as possible. Just to note, we will continue to see cases when we have our essential workers out in the community, but this is why we have our strategies, such as our COVID safety plans, to make sure that we can limit transmission as much as possible. So my shout out today was actually sent in to us from a member of the community, and it is for our home care nurses. in what I know is an incredibly stressful time, especially for those who need to have people come into their homes to provide care and support. So I'll say this exactly as it was conveyed to us. These nurses have been a personal lifeline during lockdown as we recover and receive exemplary care. And I can certainly vouch for that. We have nurses out in our community not only supporting those recovering from COVID, but providing a wide range of care to our community, and they always do so with compassion and kindness. So thank you very much for your dedication and commitment to taking such good care of our community and making them feel supported during this difficult time. Thank you, and I'll hand back to the Minister.
Minister, how confident are you that you've tracked down all patients connected to that ward at Canberra Hospital where there's been the outbreak?
That's probably a better question for the Chief Health Officer, but I really have a lot of confidence in our contact tracing team and also in Canberra Hospital staff who would be working really closely with them to identify any patient who may have come into contact with the person who has since tested positive.
The Chief Minister mentioned yesterday that mandatory vaccination for healthcare staff is being considered. How hard is the ACT pushing in those discussions for it to come about?
So there are a couple of elements to the work that the ACT is doing at the moment. The Chief Health Officer and the Clinical Health Emergency Control Centre team are working on what mandatory vaccination would look like potentially for healthcare workers in the ACT, and I think the Chief Minister's talked about how broad or how narrow the scope of that might be. I've had a couple of conversations with various stakeholders, including the Australian Nursing and Midwifery Federation and the Royal Australian College of General Practice, and my office actually met with the AMA this week as well to talk through what various stakeholders' positions are and why they're taking the positions that they are. There's also a piece of work that's being done at a whole of ACT public service level about what the policy would look like if vaccines were mandated, vaccination was mandated for any particular part of the ACT public service. So we are absolutely committed when we make these, if we make these kinds of decisions, to doing that in consultation with our unions and staff. So there's a policy out at the moment for consultation around how a mandatory vaccination policy in any part of our workforce would be managed, and that is around both how a decision would be taken, but also that there's clarity and consistency across the ACT public service in relation to how workers who are unable or unwilling to be vaccinated would be ensuring that they would be treated fairly. So there's two different arms of work that are going on in relation to this, in addition to, as the Chief Minister has indicated, that national work, the consultation with the through the AHPPC and National Cabinet. And I think the other thing that we just need to think about as we sort of look into the future is how these things are going to be managed when we move beyond the declaration of a public health emergency and the capacity for the Chief Health Officer to issue emergency directions under that declaration of public health emergency. So all of those strands of work are continuing, and we certainly are working with some speed now to have a look at healthcare worker vaccination in the ACT if and when that might be implemented.
Just following up on that, other states like New South Wales and Victoria have moved forward with mandates beyond what National Cabinet said. So we're talking construction, teachers, some disability workers. Is there a reason that, given our geographical size and presumably how much easier it would be to vaccinate specific cohorts in the ACT, that we haven't pushed ahead like the bigger states?
Look, I think there are a few things around that. We obviously have very high vaccination rates right across the community. We've seen a very high willingness to get vaccinated. The ACT is leading the nation in our vaccine rollout. We've got the highest level of fully vaccinated people, and we're continuing to rocket, I think was the description yesterday, towards that 80% double dosed. And we're including seeing high levels of vaccination across those kinds of workforces. So I think our view at the moment is that it's not necessary to mandate, but those conversations again continue on around where it would be appropriate, and also what guidance we can provide to employers who may choose to mandate that their staff need to be vaccinated.
Going back to the hospital outbreak, you mentioned all staff tests have been returned negative. How many of those staff need to be furloughed, and have we brought additional staff in from either the public or the private system to manage that or to offset those staff in quarantine?
Yeah, so obviously Canberra Health Services is managing the staffing implications of this very closely. Of course, we've seen a really significant increase in the number of staff in our health system thanks to that call out for additional staff to come on board. And Canberra Health Services routinely manages the absence of staff right across the board. My advice this morning was that there are around 30 staff who are directly impacted and currently furloughing as a result of potential exposure in this particular case. But I think it's also important to remember that this is not the only COVID positive patient that has been identified within Canberra Hospital or across our public hospital and health system. So this is a situation that's being consistently managed by Canberra Health Services and indeed by Calvary on a regular basis. And
are you able to put that 30 into perspective? Are we talking 10%? Is that, a very low number of people that would be working in these wards? Like, is 30 staff a lot of staff? Is that putting stress on these wards?
So obviously staff can move around between different wards, particularly nursing staff. So no, it's not a particularly high number in that context.
Would you like to see rapid antigen testing rolled out to hospital patients so that there can be some level of surveillance about COVID potentially entering into the hospital? Such tests are approved in Australia for use in clinical settings, but not yet at home. Does Canberra Hospital offer an opportunity for the ACT to use them?
Look, I think it's probably a good question for the Chief Health Officer as well in terms of the role that rapid antigen testing can play and the work that AHPPC is doing around that. But certainly I think the previous advice that we had was that rapid antigen testing couldn't play a particularly useful role when we didn't have community transmission of COVID-19. But now that we do have community transmission and we are moving into a circumstance where we are going to see more and more community transmission as we open up, despite our highly vaccinated population, then this is where the rapid antigen testing really comes into its own in terms of being a useful tool. Where exactly that would be most useful is I think a good and open question, but one that we will have to consider very quickly. And absolutely, health services are one potential area where it might be a very helpful tool.
How frustrated are you that we now have an outbreak in an aged care home, given that aged care vaccination was a Commonwealth responsibility and we know there were plenty of hurdles along the way?
Look, I think what this just demonstrates is, again, something the Chief Minister alluded to, that vaccination in and of itself is not a panacea. There needs to be a whole lot of other things that wrap around. We know that there can be breakthrough infections in fully vaccinated people. They can still get infected with the virus and they can still transmit the virus. The likelihood is significantly less, but it is not zero. And that's why vaccination is only one of the many measures that need to be put in place to protect our most vulnerable aged care residents, including really strong infection prevention and control. And this is not a comment in any way about the Calvary Hayden facility, but our team has worked really closely with aged care across the board to ensure that all facilities have strong infection prevention and control measures in place. We have obviously worked with the facilities and with the Commonwealth to ensure that vaccine mandate can be met that came into effect on the 17th of September. From that date, all our staff working in aged care facilities were required to at least have had their first dose of vaccine, and we know that the last data we had was that 99.2% of staff had that, and 87, I think, percent of staff were fully vaccinated in aged care. And in relation to aged care residents, 95% 95% of our staff and 95% had one dose and let me start that again. In relation to aged care residents, 95% had had one dose and 91% were fully vaccinated. So we have got high rates of vaccination among our aged care residents as well as staff, and that is the case in this facility as well.
Questions for the Chief Health Officer?
Brilliant.
Chief Health Officer, do you see a role for rapid antigen testing as a screening tool for patients coming into hospitals and other high-risk clinical settings, given we've now got community transmission in the Territory and a case inadvertently entered Canberra Hospital?
Yeah, so a couple of things about rapid antigen testing. We do need to have higher prevalence or higher number of cases in community because it does have what's called a lower sensitivity, so lower reliance on picking up our positive cases. It's really not appropriate to be used as a screening tool because part of what we want to do with screening is make sure that we identify every single case. So RATs or rapid antigen tests will only be useful once we can afford to miss a couple of cases because that's what it will do. So I think that's the first thing. There certainly will be circumstances and certain cohorts in which it will be useful into the future. I'm not sure that hospital patients is one of them, but I do think there are some potential settings and cohorts, and we're having those strong discussions both nationally as well as locally in that space.
But the ACT isn't at that point yet?
Look, I think that's for two really good reasons. The first one is I don't believe we have the number of cases in the community at the moment where it would be useful. Particularly in the hospital setting, we still do currently screen anyone who has any symptoms that are indicative of COVID infection, particularly those who come in with respiratory infections. So we're still doing proper testing of those people, and that's one of the really important surveillance strategies that we'll use moving forward, is to direct our testing towards those people where we think the greatest likelihood of them having COVID is to pick them up and where the best benefit is. I think the second thing is that we there are many public health strategies that we need to implement, and RAT is only potentially one of them. So we've got to get that as part of the bigger picture, and we're still working through those. So stay tuned. We'll certainly have more in the future.
Cohorts would be at the top of the discussion list at the moment, at least, if hospital settings isn't one of them.
Tom, I knew you were going to ask me that. I should have bitten my tongue before I said it. No, look, seriously, I know that there's been discussions about education and teachers potentially, and I do know there's some trials happening in New South Wales. I think there's also some interest in it from mine workers on locations and construction industry. I think at the moment there are some restrictions on where you can do the testing. So at the moment they're not registered to be done at home, so they have to be done supervised. So there's still a lot of issues to work through about ensuring that the testing is done in the most complete way, so we can have confidence in the reliability of the results and make sure that we're using them consistently with the registration product. So there's still a little bit of work to be done.
I wondered if you could let us know how those 9 residents from Calvary Hayden are faring after testing positive to COVID-19.
So my understanding is that none of them are requiring hospitalisation.
And in terms of their vaccination status, do we have a breakdown of the 9 cases?
I think I spoke to this yesterday, and my understanding of the cases in residence are that 6 are fully vaccinated, 2 are partially vaccinated with 1 dose and 1 unvaccinated.
Would you say anyone is showing symptoms of severe illness at this point?
I understand that there are symptoms being shown, but I don't have the information about the severity of the illness, but reassured that none have been required hospitalisation, so that might provide some confidence.
And have you had any, or do you know of any representations from family members with loved ones in that facility wanting to remove them?
I understand there's been 1 representation to the facility, and that has been managed by the Calvary staff, and I don't believe that that's an ongoing issue.
So how has it been managed? Has that application been granted? Are they able to be removed?
So I think those questions are best referred to Calvary, absolutely those details, but my understanding is that the staff and the management are working very closely with families and supporting those requests where they can.
And And I appreciate that you've probably been investigating this since the first positive test results, but any idea how the virus managed to get into the centre?
Not at this stage, no.
Just following up on that, I asked yesterday about the genomic sequencing. Has that come back for the virus? Is it linked to the ACT or New South Wales region?
No, we don't have that back yet.
There was some confusion yesterday from the residents living in the independent living villas. They're feeling scared and they're feeling confused. Do you know whether some clear messaging has been delivered to them about what they can and can't do?
So it's part of the reason why I did clarify which facility we are talking about today, and it would be great if you guys could assist us with reporting the right names so that there's some clarity there. Once again, my understanding from what Calvary has informed us is that certainly communications has been very much part of the package.
Are you able to confirm how many cases have been linked to the construction site at 7 London Circuit and whether that will be considered a close contact exposure site?
What I do know is that there are 9 cases in the cluster at the moment. 6 of those are in construction workers and then 3 are in contacts of those workers, and all of those numbers are in today's numbers. I don't have on me whether it will be a close or not, but please check the website and it will be on there.
And on that, has the site been shut down?
I don't have those details, but just to be clear that we don't shut sites down just because there are some COVID concerns on them. The site may be shut down temporarily by the owners of the business to support contact tracing and those kinds of things, but I certainly haven't directed it to be shut down.
Have any cases been connected to the testing, the pop-up testing in Watson yet?
So actually at this point in time we wouldn't know because we don't separate out the results that come back from different testing sites, but as far as my knowledge nothing has popped up from that area that would give us cause to concern that they've come from there.
Are you able to provide a bit more insight into the risk currently at Watson or that area to, establish this pop-up clinic and test hundreds of people? Has the risk gone down? Is it mitigated? Why are we kind of doing it?
So there's nothing additional than what we talked about when I announced the pop-up clinic.
I think Canberrans are very used to waking up in the morning and looking at the exposure sites and seeing bus routes, supermarkets, chemists, medical practices. This morning, there was an adult entertainment store in Fishwick, Hello Sexy, was listed. I'm just wondering what's going on there. It's clearly not an essential service.
Oh, I can't answer questions on that. I wasn't even aware it was up. That kind of business happens quite regularly. So,
do you think it's cause for concern?
I think that we will increasingly have many sites listed moving forward as we get out and about our business and essential workers continue, and I think that we should not be making judgments on people in the community.
Is there any indication about how many people worked on the construction site or need to get tested?
No, Dom, I don't actually have any further information about that, and I just think we need to let this one play out. We're working with site management and construction industry. People will come forward and get tested as necessary. The actual aim is that we have really strong COVID-safe plans in this space. Let's see how they work. Thank you.